welcome to Let's Talk Health. I'm Dr. Denothra Archer Cartwright, and I'm here with Dr. Marvin Smith. He's the Deputy Director of Supply Chain Management Agency and the Chief Pharmacist at PMH at the Public Hospital Authority. Marvin is also the President of the Caribbean Association of Pharmacists, and he graduated from as a Doctor of Pharmacy from Mercer University in Atlanta, Georgia. Welcome, Marvin Smith, Dr. Smith. Welcome to Let's Talk Health. You are basically christening our first episode on YouTube. So thank you for being here today.
Well, thank you for inviting me. It's a pleasure to be here. I have a real passion for really getting information out there to the public. And so I'm really glad to be able to be here, and I wish you best on this maiden voyage.
I know.
Let's Talk Health.
What really struck me, Marvin, is you did a speech the other day at the Rotary Club, and you also spoke with some of the papers, and you were speaking about medical marijuana and really how do we go about dealing with this here in Bahamas and here in the region. What made you want to speak on that topic in particular?
Well, I'm a member of the Rotary Club of West Nassau, and it's very rare that they invite their own members to talk, but this issue, I think, hits home. I'll give you an example. I had a member come up to me and say, this topic was so timely because my wife is dealing with dementia on Alzheimer's. And I read that medicinal marijuana can be used for treatment for this. I've had other people call me and email me and say, I'm glad that you're talking about this because my family member went through this with cancer, or went through this with something else. And so for me, it was really important that we really focus on the medicinal use. There's so much in the papers and the media and some other things about decriminalization, and we're seeing what the region is doing. But I really wanted to put it out there that these plants have a purpose. Everything that's been created and put on this earth has a purpose, and has a good purpose. And so we go back to the story of creation, and it says that after the Creator looked down and saw what He created, He said it was good. And so even though we use some of these things for maybe some other things that we shouldn't, there's some good in everything. And so I really wanted to bring that to the fore as we really engage people to take more of a personal responsibility about their health.
Excellent. And that's what struck me too, because you were not speaking about recreational marijuana, but you were talking about medicinal uses, which is, I think, what we should focus on really, because I'm not really an advocate for recreational use, but I know as a medical doctor that most of the headways that we've made in medicine, we've always kind of based it on plants, and then we've been able to use those plants to come up with other compounds and to use that in a particular way. And there is a lot of talk right now about the different uses for medical marijuana. What are some of the things that you think, because there are some findings that are coming out now, they're actually doing more studies into it to see what uses are proven. What do you think about that, and what do you think that we'll find here in Bahamas?
Well, I think there's some really exciting things coming about, and I really want to preface this by really agreeing with you. I'm not a proponent either way for recreational use of marijuana. I think that's a personal decision. Of course, the law itself has something to say about the use now, and for that to even be discussed, we'd have to look at the law being changed. Keep in mind that marijuana is a Schedule 1, and so it's been identified as a product that has no medicinal value, and that's why it's a controlled substance. What I'm saying is that that designation, that categorization of it, was done years ago, decades ago. And as information changes, we should change. As we grow in knowledge and capacity, our understanding of things should also grow. And so I'm not going to get into the discussion with whether somebody wants to smoke weed, as we call it, on the block. That's something you got to figure out for yourself and with the law. But I'm looking at where research is heading. And the talk I gave the other day at the Rotary Club really was talking about the top 10 reasons for the medicinal use of marijuana.
Yes.
So one of the things I think we have to educate people on is that marijuana itself really can be broken into two major types of medicinal products. You have medicinal products that contain THC, which scientifically we call it the 9-tetrahydrocannabinol. All right, so we call it THC for short.
And this is really the stuff.
Right, and this is the stuff that gets the euphoria.
Mm-hmm.
THC is the substance that can get you quote unquote high. All right. However, we also have in marijuana these substances called cannabinoids.
Right.
We call them CBDs. These have medicinal values and do not produce the euphoria. And so when we look at why marijuana should be at least looked at as a viable
and it's
option.
the cannabinoids that really the receptors are in our brains.
Exactly. And so from our end, while there is use also for THC products, and we've seen that.
Yeah.
All right. What I'm really promoting and trying to look at is that whole issue of utilizing the oils and the extracts that are found in CBDs. All right. And states as near to us as Florida already approved this. In Florida, you can get a license to grow marijuana for commercial use, but you can't use the flower. You can't use the pot we smoke. It's the oil and the extracts that they use. And so the first thing I try to drive home is that when we look at the long-term negative effects of marijuana, they are primarily associated with smoking THC. Mm-hmm. Okay? And most of it is really because it's smoking. Right. Putting a heated vapor, a superheated vapor in your lungs is just not a good idea to begin with.
So is that why a lot of the products are moving to like oils?
You're seeing in oils and the vaporization where you don't get that super hot smoke and those sort of things. And so from our end, it is the smoking part of it that brings some issue. But even then, there's some positives to that. All right? And so what you have here is that's the first issue. The second part about it is that we do know that the use of THC has shown in some trials and some research to have an effect that impacts negatively brain development in young people.
And I've seen these studies where they've looked and they say up to even sometimes the age of 21, you can see these impacts on the brain of young people who are smoking, especially if they're smoking heavily. And we seem to have, an issue with our younger people smoking heavily in this community. And I think that's where it becomes controversial because we know that people are smoking it from a very young age. Are they going to go in there and find uses for the medical marijuana that they shouldn't be? It's a lot of things about the law and licensing this properly. It's a very tricky situation.
I don't know if it's as tricky as people make it out to be. And I'll tell you why. We have in our society now products that aren't even medicines that are controlled, they're regulated. So we know that alcohol impacts growing cells, brain cells, liver cells, kidney cells. And so we've realized that we don't serve alcohol here unless you're 18 or over. In some countries it's 21. There's a reason for that. It's not so much just the impact of alcohol in terms of getting drunk and some different things. It's also because physiologically, the body's not designed to deal with that level of alcohol use prior to developing certain organs. So if we see the same things in THC, then maybe this is something we need to control by age. I've seen some recommendations where as early as 21, they look at shutting off up to 25. And I would be more than happy to err on the side of caution and say we shouldn't have people exposed to marijuana, particularly in the THC smoking form, before the age of 25. All right.
We're seeing though, Marvin, in the Dr. Smith, in the U.S. that a lot of they're actually giving cannabis products to a lot of children.
Yes.
Seizures, neurological problems, disorders that have lots of pain involved. And that has also become controversial, especially with the fact that it does have these effects on a child. How do you mitigate that? How would you deal with that?
Well, I think we mitigate that like we do everything else in the practice of medicine. What's the best thing we can do that causes the least amount of harm? And so you take a child that has 300 seizures a day, and we're able to vaporize, or for me, my preferred recommendation would be the oil, okay? And we say, okay, fine. Yes, we may have some negative effects down the road, but if it helps to get that child to function and not have 300 seizures a day, you weigh the best possible outcome. We see the same thing in a lot of ways for some of the research that's coming out where they're treating veterans with post-traumatic stress disorder. And yeah, they're smoking it, but these men and women that are coming back from battle with injuries and mental issues are now being able to function more. So you weigh it and you look at the cost versus the benefit. What we've seen though is that our CBDs work. They work in a number of diseases, and cancer, because
I know the nausea, the vomiting.
yeah, well, not even just that. CBDs have been found to be a natural tumor growth inhibitor. And for those who may not understand it, what it basically means that when you introduce CBDs into the tumor, it stops a tumor from growing. It has that property, and it does it. And so you're looking at the fact that Alzheimer's, which is basically the production and the proliferation of plaques, in other words, scales on the brain, we see that CBDs prevents the formation of these amyloid plaques. So they help to treat Alzheimer's. They help to delay it. Nothing is going to cure it, but help to delay it. They help to treat the symptoms of dementia. We talked about seizures.
Right.
We talked about there's migraines.
But the seizures is kind of, there's different views on that. There's different studies on that. Some have not been totally conclusive.
Well, because cannabis as a whole, and particularly with CBDs, have what we call strain specificity, which means that there are different strains of marijuana plant. Those different strains produce different effects. Remember that marijuana is essentially a plant. Mm-hmm. It's composed of DNA, just like me and you. And so when the DNA is different, you get different impacts. The same way your DNA has you to be 5'5" and brown skin, and my DNA has me to be 6'4" and darker skin. And so marijuana is the same way. And so there's this thing called strain specificity. And so we have to look at not just what the studies are saying, but what strains are they using, all of these things. We know so little about this. We're just scratching the surface.
There's a lot more to be done. And then we also know that marijuana sometimes works differently with different people.
Oh yeah. You're talking about a drug that has an effect on the psyche, on the mental state of the patient.
Yes.
And that's even the ones that don't produce euphoria. Mm-hmm. All right. And so the metabolism of the patient's background, the patient's diagnosis, the patient's current health status. So we're seeing a lot of these different things. I'll tell you a very interesting study though, coming out of the Harvard's Women's Hospital in Boston. They're researching women in particular, but also men who are having problems anywhere from postpartum depression to anxiety to cancer, you name it.